The House Oversight Subcommittee on Child Welfare System will come to order. Will the clerk please take attendance?
Chair Mearman?
Here.
Representatives Regas? Here. Paquette? Here. Conlon?
Here.
McDonald? Here. Mr. Chair, you have 5 members present. You do have a quorum.
Representative Regas moves to approve the minutes of the October 21st meeting. Hearing no objection, they are approved. My apologies to the committee for being late. I had a mother stop me outside of the last committee hearing we had and wanted to talk about her children. Today we'll have testimony from individuals who have received pediatric care for gender dysphoria and related hormone therapies. We'll also hear from an individual who has overseen this care in a clinical setting. While you all will testify separately, I want to thank Joni Skinner, Precia Mosley, Jay Skeeters, Jamie Reed for testifying today. It is the intent of the subcommittee to better understand the care administered to minors facing gender dysphoria, and your testimony will support this body's efforts. I want to welcome Johnny Skinner and his mother, Melissa Skinner, who are testifying by Zoom. And begin when you're ready.
Thank you, Chair and members of the committee. So I started transitioning. I'm 22 now. I started transitioning when I was 13 years old in the 7th grade at Children's Mott's Hospital in Michigan. They were running a comprehensive pediatric gender care program. Initially, I went there looking for therapy in regards to internalized homophobia due to growing up in a religious background, as well as bodily distress with starting puberty. Instead of providing me with any therapy, the gender therapist had said that I had a female essence and that this was the only treatment option available for me. I had asked her about, a lot of my fears growing up being gay and my fears with how that would contrast with my religion. And she essentially provided this as a way out of being gay. She said, you're right, you probably won't be as accepted in the gay community due to your effeminacy. So this will be the right path for you to live a normal life in society. And it's good that you came today because most 60% of kids commit suicide if they're not able to transition younger. So with that belief in mind, I believed that this was the path that I had to take. And after that first appointment, I was referred to an endocrinologist at Children's Mott's Hospital. And within that first appointment, he echoed a lot of the same sentiments that the gender therapist, Sarah Weiner, had told me about being gay and how I more than likely had a female brain and a male body biologically. So therefore, this is the only treatment path available for me. And I was prescribed hormones after that first appointment. I never had any kind of proper therapy or anything as I went through this whole process. I had many, many medical issues. My mom here took me to many, many doctors to get them addressed, but everyone had told me that this is the only path for me and that she was more than likely saving my life by putting me on this path. And I had lived in the life on these medications for 8 years as a result, up until 2024 when the WPATH files came out. And I had finally realized that this care that I was put on I wasn't provided with enough information to have made that decision as a kid. I didn't understand what I was getting into. So, yeah, that's my testimony. If you guys have any follow-up questions, I'm totally open.
May I speak?
Yes, go ahead.
Okay. This is my first time speaking about this, so thank you very much to the whole committee and to Brad for trying to look out for kids. Sorry, this is kind of emotional. Since WPATH files, Johnny's been trying to speak about this. This is my first time because I feel that the committee, this is probably the best place for someone to speak, you know. I'm going to try and make this short. You sent a short PowerPoint over of things, touch points. So I kind of wrote a sentence on each, and then I'll leave it open for questions. I'll answer any questions to anyone, even though I've not spoke on this before. I'm 55. Johnny was 13 when I took him to the hospital. To touch on my background at the time, my mindset at the time, I was losing a home. I was going through an abusive relationship. I lost a relationship, a home, a business. I had a dealership. And I was trying to create another. I'm an entrepreneur. I was losing one business and I still need to support my kids. So I was trying to build another business at the same time. Johnny came out and told me he was trans. I had no idea what it was at all. But the math tutor that I was paying, a friend of mine's kid that was watching Johnny, had been talking to him about it. And I didn't know. So they had a person, a therapist at the U of M that they referred me to because I could ask questions and I could learn and maybe I could get some help for my kid who was very distraught. And so I went and your next question was adequate diagnosis. No, there was not an adequate diagnosis at the first therapist. I'm shaking talking about this. Sarah Weiner talked to Johnny for maybe 2 or 3 hours. I don't know. I sat in the waiting room, and then when she called me in, it was, "Congratulations, you have a daughter." That was her words to me. And I said, "I don't understand." And, you know, basically by the end of the conversation that I wasn't understanding, she made it very plain. And she said, "You can have a living daughter or a dead son. I think you've saved his life. And I'd like you to speak with another doctor. I'm going to give you a referral." It was very disturbing. Was told 60% of kids from 13 to 23 don't make it. So really all the questions that I came there with didn't really get answered because now I'm in a whirlwind of my kid's going to commit suicide. That's what they've been in there talking about for a couple hours. Don't know. Sorry. So anyways, did I understand? No. But a living daughter or a dead son was pretty clear that there was a bigger issue than what I thought because I was worried about my own world, right? Trying to keep food on the table in a house. So I went to the doctor. Sarah showed up there. It was Dr. Schumer at U of M. Was I told about risks? No. I was shown a whiteboard. And I was shown that this probably happened in the womb. Not all brains, every embryo is female. And for some reason, not all brains develop male. And I mean, they had a scientific reason. Every question I had an answer. I asked about side effects. You know, I was told I had limited time to make this decision because I wanted to wait. Johnny had never even dressed as a girl before. Like, this was like a new question. So I wanted to wait, you know, right? Give my kid a chance. Let's put him in a girl clothes first. I was told I didn't have time. I was on a very short time list, or Johnny would pass as an adult later because I was going to screw it up. And then when I still had questions, it was more of, look, if you're not a supporting home, we have supporting homes. And then looked at Johnny and said, we have people that will help you and you can stay on this path. So now I'm panicking. They're talking about me losing my kid. They're talking about my kid dying, and this is my visit too, first introduction with the doctor. Your next question, discussion about risks. I was told that all the side effects were reversible, except for if this was right for Johnny and he stayed on it long term, he might not be able to have kids. There's not enough evidence for that. There was no other side effects. Everything was reversible. Discussion of D-trans. I didn't even know what D-trans was for years after that. No, there were no discussions of that. And if I asked him anything, by the way, our doctor, I don't know about everybody's doctor, our doctor was gay. So by visit 3, concerned mom, he's nice, he's happy, he's painting a picture of this is a better life. So me, I'm trying to innocent. Maybe this guy is he's a doctor. These are all professionals I'm talking to at some of the best hospitals in the country. So now I'm questioning my own self, right? And I'm trying to save my kid's life. So my question on third visit is, I'm so glad you're doing this for kids. Did you feel this way when you were a kid? Is this why you're on this path? Immediate offense. No, there's a difference between gay and trans. Johnny's brain is different. So, and then after that, any questions I asked, like, were there dissenting questions? Oh, wait, I'm sorry, I skipped one. Number 6, doctor, did the doctor have him alone? Doctor had him alone at the end of every visit with me, every one of them. And it was common practice. So I needed to step out of the room. Number 7, were there dissenting questions? Anything I asked after first or second visit was inappropriate. When Johnny started having issues that I believe now, since WPATH files came out, I believe is from the meds, and they were awful, awful side effects within the first year. And I started asking questions, and I was told they were inappropriate, or I was told I needed another doctor that handled stuff like that, because none of that had anything to do with his job or the meds. And these questions were very important. And if I tried to get another doctor, no doctor wanted to see Johnny because they don't understand the meds. So we had no other doctors. And until there were things like when he was peeing blood. And I took him to a specialist. They dealt with it. Something had caused a ulcer in his bladder. He had a biopsy, had surgery and stuff. He was 17. Dr. Schumer wrote in the notes that he had a kidney stones or something and excused it off. And none of that was true. And I have the other medical records that I could send so that you have those to go with the ones from U of M. And I spent many years then questioning the medicines, but they had Johnny so convinced. And when we questioned it, if I take him to a doctor because I questioned it, those doctors would say that it can't be the meds. So I looked like a crazy person for years trying to find out why Johnny has a lot of the stuff that he has going wrong with him.
Thank you,
and
Melissa.
Until the WPATH files came out, Johnny was still on the meds until then. So 8 years.
Thank you so much.
Sorry.
Johnny, no. Thank you, Melissa.
Thank you.
Kids are a gift, and we thank you for both of you. Representative Paquette.
Thank you both for your testimony and being able to spend time with you. And I know you mentioned sharing medical records with the committee. We can do that. You shared them with me, and looking through them, the reasonings to be put on puberty blocking drugs and cross-sex hormones was a specific endocrine disorder and ICD code that the doctor put in, and I saw it was used about 111 times in the records of 600 pages. And this endocrine disorder related to puberty, Johnny, did he have this endocrine disorder? I'm reading, what this is specified for. It's for things like androgen insensitivity syndrome, carcinoid syndrome, ectopic hormone secretion. Did he have any of those ailments?
No.
And
No, I did not. And if I may comment on that real fast, I did not realize that I was diagnosed with an endocrine disorder related to puberty. He never discussed what he was putting in my records. So we were not informed as to those diagnoses until much later when we pursued my medical records after I quit hormones.
My understanding is that's very clear insurance fraud. I also noticed that you were diagnosed with tall stature, as if it's a disease. Could you fill in a little bit more on that?
Yeah, so Daniel Schumer, he wanted to stunt my growth because he estimated my adult height would have been between 6 foot and 6'2". So he said that I would be too tall to pass as a woman and have a livable life. He said I would have a significantly harder time finding a partner if I was too tall. So he pushed for me to have my growth stunted with high dose estrogen. And tall stature, I assume, was the diagnosis that he put through to get that accomplished.
That's what's in the records. And then lastly, I noted that you were sent, when you were 13, you and your mother, Melissa, were sent to a sex shop. Could you fill in on that?
I'd like to speak on that, too.
Yeah. Could you fill in on that briefly?
Yeah. So Sarah Weiner and Dr. Schumer, on the first visit when they were together, decided that because I'm unsure about all this, Johnny needed form fitting to feel feminine. And I'm going to try the clothes. Okay. I'm going to try, I don't want the meds if I don't know what this is. So they said, you need to go here and get form fitting stuff. Okay. I'm a woman. I'm picturing, cloth stuffed stuff. So we're in Ann Arbor, Detroit, by the way, which I'm from the other side of the state. So I'm on Lake Michigan. So I don't know anything over there. So we leave the hospital and I take this address, this note, sticky note that's on her business card, and we drive to this place. When I pull in, it is a purple building. And so for me, I'm thinking, this is not where I'm supposed to be, right? Something's wrong with my GPS. So I sit there and I Google it. Nope, I'm at the right place. And this is the name of the place. So now I'm like, I'm not saying anything to Johnny. I'm like, okay, maybe I can find these clothes at a local store. Let me look at some of the stuff online. So we sat there for a bit. I looked at the local stores and they don't seem to sell what she's saying he needs. I'm like, all right, I'm going to walk in here and see what this is about. So we go in and they take the sticky note and they say, well, follow me. I said, are we going into the building? And she said, oh, it's okay. Everybody is a little nervous. Just have him not look at it. We're just got to step past this stuff. And it was a lot of wigs and 6-inch shoes with the big platforms and feathery stuff and stuff like that. But I can see on the wall around the corner, there were things that reminded me of what would be like a lion's den. And I'm like, I looked at him and he's convinced he needs to see what this stuff is. So now I'm afraid my kid's suicidal. So I'm just trying to get through this. So we go in and now it's sex toys and stuff for around the corner in lit up displays on both sides and get around the corner. And then there were form fitting stuff with, like fleshy, like rubber, right?
Cyber skin.
Yeah, whatever is in this stuff. I look at it, I said, you want it? And he's like, not really. And I'm like, okay, well, I told him I would get it. So I'm going to get it. You try it on. You don't want to wear it. You don't have to wear it. So I bought the shorts that had the butt and I bought the t-shirt or the breast forms and we left. When we went home, We talked about it on the way home. He thought it was weird too. He wasn't comfortable with it. I'm thinking, I don't understand why he would need to look like a young woman then, because he's 13, so other girls didn't look like that. So we had that talk, and then I said, he didn't even want to try them on. I said, I just spent a couple $100, please try them on. He tried them on. He actually didn't try on the shorts. He started to put the shirt on. He said, it feels weird. I don't like it. He never wore them after that. Once we got the medical records, I see that they say in there that he never wore them after. We threw them in the garbage. And they never asked, and he never wore them to an appointment. Like, he never wore them. So I don't know why that kind of stuff, why they put stuff like in there was something that Johnny wanted and liked and was happy for. None of that stuff even.
None of that was true.
No, none of it was true.
And my last
So
point,
that was
Mr.
our experience at me thinking we were going to a clothing shop. And by the way, I then wanted him to try to dress as a girl before he got on the meds. So I took a contract 6 weeks in Florida. And while we were down there, I went to an elder Bierman's to find him some clothes. And they had cloth, because now it's on my mind. So I'm in the women's section saying, I wear a padded bra. They got to have something that's more than that, right? And they had all that in a women's section in an elder Bierman's that wasn't fleshy, that could have given a young person a form without going to a place like that, which is what I was trying to look for online. But I was looking up the names of stuff they gave me, which wasn't the same thing as what a normal woman would buy in a store.
And I appreciate you
So
expounding
it was
on
just
that.
an off the wall crazy experience.
It is. And on the last note, I guess, with the unique ailments that Johnny does have now and the finding care, could you just touch briefly on that for us as well in the committee?
Yeah, so when I was on the hormones and specifically the blocker, I was having terrible muscle spasms, muscle atrophy, and she had mentioned I had started peeing blood. I did start peeing blood for that time. I was developing spontaneous ulcers in my bladder with no pathology present, so they didn't know why they were forming. I had also started having issues with sexual dysfunction at the time, like many intimate dysfunctions, breast pain and fluid leakage. I used to leak so much fluid that I would have like circles on the outside of my shirts. None of this was addressed by the doctors at U of M. Whenever I bring it up to them, they'd be like, that's just a normal part of womanhood. So I never got addressed at U of M. I had a surgery done at Corewell for the biopsy and that ulcer in my bladder. And around that time, Mom had gotten so freaked out about this stuff that she did fight to get my blocker taken out. And I would say
About 8 months.
a few months after it was taken out, though, I stopped having the ulcers in my bladder, but I've had urinary incontinence ever since, constantly through the day. I essentially am like a faucet that won't turn off. I still have fluid leakage that comes from my chest and pain in my breasts, as well as bone issues. I have bone that's growing in my joints, and my current doctors don't understand why. They're seeing these bony protrusions form over the past year and a half since I stopped hormones, but they aren't sure as to why this is happening to me yet.
You have a surgery on your wrist coming up.
Yeah, but that's not related. So there have been a number, and I still have sexual dysfunction. So that's like a short synopsis of the medical side effects of it.
Thank you both for your courage in testifying, and you both deserve justice in this all.
Representative Regas.
My question has been answered. Thank you.
A quick follow-up question. Did you get any indication whether or not other kids' parents were sent to that store that you were sent to, the sex shop?
No.
Okay.
Oh, but I will say that they acted as though it was very normal when I got in there because they did try to calm my anxiety and evident nervousness with being in there. Like it's normal. Everyone feels this way. You'll only be here for a minute.
But we do not know anyone else
I
that
do
was
not.
sent from the clinic to that store.
This is my first time speaking. I don't actually know anyone else. I have been focused on work, business, and Johnny's health, really.
Representative Regas.
Thank you, Mr. Chair. Thank you so much for your courage and being here. And could you provide to my office the name of the store that you were sent, please? Okay.
Yes.
Do you want it now?
I mean,
It's-
that's up to you.
Yeah, it's Janet's Closet.
Janet's Closet, and I believe it was Detroit, Michigan. It's like an indiscreet purple building if you Google it.
I went from Ann Arbor to there, so it had to be close proximity, I would assume.
Okay, thank you.
Yeah.
Thank you both. I'm grateful for your willingness, and Johnny for your bravery. Next, we're moving to an in-person testimony. We'll hear from Prisha Mosley. Prisha began receiving hormone therapy as a minor and was on a path of medicalized gender transition, overseen by counselors and attending physicians. Prisha, thank you for being here. There's a red button in front of you. And again, thank you.
Hello. Can you hear me? Okay. Thank you so much for having me. My name is Prisha Mosley. I am 27 years old and a mother and stepmother. These days, I spend time enjoying motherhood and advocating for the healthcare rights of people who identify as trans. Everyone who seeks medical advice or care is entitled to evidence-based and ethical care and the truth. Before my transition, I was struggling with numerous mental health conditions. My parents were trying to get me help because I was cutting myself and needing stitches. I couldn't eat and I was delusional. I had a traumatic experience with a sexual assault and a miscarriage when I was 14, which led me to become unable to eat and to reject myself and my sex. At 16, I was seeing a nutritionist for my severe anorexia when my eating plan caused me to start my period again, a traumatic experience after having made it go away through starvation after the sexual assault. I said that I wanted to be a boy, and a pediatric endocrinologist began seeing me in the nutritionist's office behind my parents' back. Months later, I was prescribed and being injected with high doses of testosterone. They billed insurance under endocrine disorder unspecified, even though my endocrine system was healthy. The steroids would go on to cause irreversible damage to my body and induce numerous health conditions, which I am still fighting to treat today, 4 years after stopping the hormones. The effects are irreversible. My body will never be like it was before. My doctors purposely disrupted my healthy hormonal balance and destroyed the function of my endocrine system. I am now dealing with continued hormonal imbalance, PCOS, high cholesterol, an enlarged liver, muscle tension, Hashimoto's disease, facial and body hair, joint pain, chronic fatigue, and more. I shouldn't be dealing with any of these conditions, and I wouldn't be if my doctors hadn't knowingly induced them in me, trying to disguise my sex. They've made me into a lifelong medical patient the day they pathologized and medicalized my mental distress. When I was a teenager, I was almost robbed of my ability to have my child. I was a minor when doctors prescribed me high doses of testosterone, rendering me infertile for years. The hormone treatments also prevented me from completing puberty such that my hips are not spread like an adult woman my age should be. I was not able to deliver naturally due to this, instead facing another surgery and more trauma. What is worse, I faced surgical complications as a result of the fraudulent and unnecessary double mastectomy I was given when I needed help. My surgeon left pieces of breast tissue inside of me and grafted my nipples, surgically severing the connection to my remaining milk ducts and sealing my chest shut. My milk came in, and I spent the early weeks with my son screaming in agony, wishing I had never put my trust in the so-called gender experts. Did my surgeon know this would happen to me? Did he never consider that I might grow up one day and want a family and a normal life? Was I supposed to hate myself and reject biology and science forever? I was never given an accurate diagnosis. I needed mental health treatment, and instead I was defrauded into believing I had an intersex condition wherein I had a female body and a male brain, and that I needed to treat this incongruence or die by my own hands. My doctors did not adequately describe the risks. Instead, they lied to me about the nature of transition. I believed that I was going to change sex. I was also offered no other option. My parents were asked in front of me, would you rather have a dead daughter or a living son? Even though I did not have a life-threatening condition and they did not have life-saving treatment. The doctors offered snake oil and sold it as the only option. There are already protocols in place for suicidal children which don't include disguising their sex and lying to them. I deserved ethical care, and I have come to realize that instead, I was given extreme medical and sexual abuse. My genitals were disfigured by chemicals before I could consent to sex as an adult. The first change to happen to girls and women who take testosterone is bottom growth and atrophy. These are irreversible, and now I cannot engage in things without pain and risk. My doctor never discussed detransition with me. They never even told me that regret was an option. I didn't even know the word detransition when I first experienced regret. I thought that I was completely alone. They gave me a fraudulent diagnosis and told me that my only option was to transition to save my life. I deserved better, and so does anyone else who identifies as trans. No human can change sex, and no cosmetic alterations to disguise the sex can cure a single mental health condition. Purposely disrupting the endocrine system's delicate balance worsens health every time. Inducing hormonal imbalance in traumatized girls, in children, in the mentally ill, and in homosexuals is a human rights violation. No doctor has the right to make money shortening the lives of their patients by defrauding and harming them with unnecessary drugs and gruesome surgeries. I was made into a medical experiment, and the experiment was a catastrophic failure. Thank you.
Thank you, Prisha. It's not the first time I heard the story, but it's still hard to maintain composure. Thank you for being here, Representative McDonald.
Thank you. All of this testimony today is very sad, very upsetting. Seems like there were, it's one thing to have bad doctors when something's, small, but this is massive. So I thank you for coming and telling your story today. I do wish we had the stories of other people. There are many people, I know many parents who have trans kids who are hoping that their rights are recognized as well, and that trans people are hoping that they're recognized as well. The recent study, including about 90,000 people, found that only 1% to 2% of people who've had transitions are dissatisfied afterwards, and that includes, of course, adults. And I think we should respect what's really happening in science, and I hope that we just don't all come to one conclusion here. There are many people who are adults and have transitioned and are very, very happy. It's a very rare situation I think we're talking about here exclusively. Thank you.
Am I allowed to respond?
Yes.
Thank you for addressing me. I just wanted to say that a couple years ago, while I was on anabolic steroids, which are known to mask depression and elevate the mood, I would have also testified that I was happy. It's very difficult to admit that you were wrong and to realize that the people you relied on and who told you that you were saving your life and called themselves the experts were lying to you, and to realize that you can't really change sex. But people who identify as trans deserve the whole truth. But luckily, happiness isn't how we measure the success or efficacy of medicine. Otherwise, we would just give patients morphine, and then they would say that they were happy, and we could call it morphine-affirming care. But the medicine is meant to actually heal people and help them, not just make them happy.
Thank you.
Once people are
Representative
adults, they deserve their civil rights.
McDonald, thank you. Representative Regas.
Thank you, Patricia, for your bravery and your transparency and your honesty and your testimony. And it, to me, it doesn't matter if you are 1% or 2% of these so-called transitions, because you matter, you are important, and you were misled, you were lied to, and you were used by a system that is now promoting this gender issue. And we know, like my colleague said, you know, it's science, right? Science-based. Well, it is science-based that you cannot change your gender. You can do all of these things, but you will never be the other sex. And I appreciate the fact that you not only recognize it, but you use your voice to advocate for the many people out there just like you. Because we know that there's a lot of people that regret this decision because they were also misled and lied to. And many of those people do not have your courage to step forward, to say it's 1% or 2%. I believe that is very inaccurate. And I don't have a question for you. I just want to praise you and love on you for having the bravery to be here today in the face of this big machine that is pushing this agenda on our children to mutilate their bodies and disrupt their hormones and live with the medical consequences and these conditions that they are stuck with for the rest of their lives. So thank you. I can't thank you enough.
Thank you. Even if the regret rate isn't 100%, the rate of lifelong medicalization once you start hormones and disrupt your endocrine system is 100%. Whether you experience regret or not, a person who identifies as trans is meant to go on to continue to have surgeries and take hormones for the rest of their lives. And if you want to stop like me, your endocrine system still won't function and you have to take hormones the opposite way, either way. So even the people who are in the community I once was, who still believe lies, are still victims, and I'm here on behalf of them.
Representative Paquette.
Prisha, thank you so much. You're a true inspiration. I've told you history is going to remember your name and the courage that you have and a lot of the arrows that come your way for speaking in this on science in particular, and me talking to a lot of the gender doctors and quote-unquote experts. The studies they point us to track kids for 1 to 2 years. They aren't long-term. And so the evidence base around this is very weak, very low quality, as we see in the UK HHS report. All points to that. So I want to make that known. But in terms of where you are now in receiving care for the unique situation that you've been placed in, I understand that you have to go to a therapist in Ohio for care. And could you speak to that a little bit as you live in Big Rapids?
Yes. Actually, my therapist is in Florida and my doctor is in Ohio, just because of all the issues around care and the worries that clinicians seem to have around anti-conversion therapy laws. It seems not only do people not want their care to be misinterpreted, because first of all, no one is converting me or anything. I simply choose to believe in science and put down my faith in the idea of gender and to believe in biological reality instead. I'm not being converted. But they seem to be afraid that helping someone go back or not transition or doing anything but the affirmation-only model is conversion therapy because of the way these bills are written. When I was pregnant and postpartum and seeing my midwife, she would only meet with me like in secret and behind closed doors. And she, thought the transition was wrong and I shouldn't have had my breasts removed before ever having children. And, I asked her why she didn't become a whistleblower or anything, but she kept working and talking to me behind closed doors because while I was there being pregnant and stuff, 2 other women were at the birthing center who had had top surgery too. And then I faced these extreme complications she had never seen before, and I don't know if that happened to the other 2 women. And just like people are going in blind on this, but like doctors who want to help and who are helping on the back end and picking up the broken pieces are all having to do it like in secret.
And this is something a lot of people don't realize. And everyone needs to hear your story here in the state and understand what these laws have been doing. So thank you so much.
Thank you. I'm so grateful for you guys listening to me, including all of you. Thank you for your questions. I hope you have a good day. Oh, wait, was that all?
Yes, thank you.
Okay, thanks.
Thank you again, Prisha. We'll now hear from Jay Skeeters, who receives hormone care and related procedures as a minor, who received hormone care and related procedures as a minor, but it was not until he became an adult in requesting medical records that he learned that the extent of the care he received. Jay, thank you for your testimony today, and push the red button when you're ready.
Thank you, Mr. Chair, and thank you, members of the committee. I'm pretty old, so my story is pretty long, so I've decided to put it in more of a timely timeline for brevity. My name is Jay Skeeters. I'm 48 years old. I was born in 1977, a healthy baby boy, but I was born with hormonal imbalances resulting in gonadal dysgenesis. The doctors feared that my reproductive organs being affected by the dysgenesis, I would have a hard time leading a normal male life. They shared their fears with my parents and pushed my parents into making quick decisions about me that would change the course of my life. There was an ideology that is unfortunately still going on today by Dr. John Money out of Johns Hopkins University. He believed that children who were born with reproductive abnormalities could be raised as either gender. His theory was that if you perform surgeries within the first 2 years of life, then you could raise and socialize the child according to your chosen gender, and the child would accept and identify with that gender. So a medical team was constructed and led by my pediatrician. They easily convinced my parents that it would be in my best interest if they performed a gender reassignment surgery as early as possible. My parents agreed since they didn't know much about gonadal dysgenesis and were trusting of the medical experts, as they would also have my best interest in mind. Growing up, I was never really aware of my diagnosis. All I knew is that I had a lot of surgeries, infections, painful procedures, big scars, and strange psychological visits. I remember just being very anxious every time I had to go to the hospital. I would stay up all night scared because it hurt so much. There was a lot of pain involved. It would keep me up and make me sick to my stomach. But I had to be brave. I had to kind of hold things in because I didn't want to upset my parents. Because my diagnosis was never explained to me, I was left up to sort of my imagination. I always knew that there was something off about me. I didn't have any type of connection with being female. I actually listened to a tape recording of myself when I was 3 years old saying that when I grow up, I'm going to drive a motorcycle just like my dad. I have a long beard just like my dad. Because I didn't really understand anything that was going on with me. The older I got, the more awkward I became, being socially raised as female. School had become increasingly challenging because I started getting in trouble for being too boyish, which scared me because I hated getting in trouble and didn't understand what that actually meant. Outside of school, I did nothing but play sports, specifically basketball, as this was the only time people were happy to see me be aggressive and associate with other children who I felt like an alien amongst. Around 11, 12 years old, things really started to get dark with me. That was when they told me that I had to start taking female hormones, estrogen and progesterone. I started to feel psychologically unstable. I remember asking my parents all throughout my childhood, what was wrong with me? Why did I feel this way? There's got to be something wrong with me with all these surgeries I have to go through and all these hospital visits, and I have to take these hormones, and I don't understand what's going on with me. And I always received a scripted, uniform response throughout my whole family. They would say, "You were born female just without any female parts." Well, I mean, when you're young, it's like, okay, it doesn't make any sense, but it's enough for me to, sort of carry on. But as I got older, I wanted to push back a little bit further, like, what does that even mean? How does that make me a female then? But then I saw that outside of that scripted answer, there was no better answer. I'd hit a brick wall that I was not going to get past. Being raised Christian, we're taught to obey and honor our father and mother, so I didn't press. But the hormones brought me to a point where I knew that I needed to stop taking them, and that's what I did. This was my first act of silent rebellion. I started throwing them away and would lie about taking them consistently because I knew that I had to. The hormones were really driving me insane. Finally, my parents spoke to the medical team about my difficulties, and I was brought in and asked if I would like to be raised a boy. This was shocking to me. Like, what kind of question is that? According to my faith, God doesn't make mistakes. So if I were born female, why on earth would I change myself into a boy? I'd rather continue to suffer than to go against my faith. Had I known the truth, this would have been a completely different conversation. In the meantime, I continued to spend all my time playing basketball. I found identity and normalcy through it. And it gave me social connections, confidence, and eventually a full scholarship to Villanova University, and also after that leading into a professional basketball career. Off the court, I still felt like an alien. Despite the athletic awards and accolades, every time I looked at myself in the mirror, the reflection looking back did not match, and I was uncomfortable in my own skin. I'd become used to the feeling of being odd, so it just became part of my life. Basketball was my only comfortable identity. In my 30s, I knew that identity wouldn't last. I'd become a professional trainer in my 20s since movement was part of something that I could always count on, and I continue that work today. After retiring from basketball, I fell into depression. It had been the biggest part of who I was. I withdrew to my apartment. Eventually, I confided in a client who was like a mother figure to me about my secret life, the surgeries, the hospital visits, the unanswered questions, the disconnection from everyone. She suggested I looked into my medical records. 4 weeks later, I got the package. So it was around 300 pages of medical documents. Documents stated that I was born male with gonadal dysgenesis, and it was decided to perform a gender reassignment surgery on me as a baby. I was exhilarated. I sat there all night long on my floor and just read every piece of information about myself. I thank God over and over again. I remember I just kept saying, I knew it. I knew there was something wrong with me. I knew it. I knew that my life was all wrong. After a while, it started to sink in, all the horrific surgeries performed on me, the psych visits to install this brainwashing, all the lies, all the awkwardness that was completely unnecessary, all of the painful procedures that I had to endure, and most of all, the lost time that I had to play in this character, in this sick, twisted story. But in the darkness, I got the truth, and I just couldn't stop smiling. I just kept saying, like, I'm free. I'm free. I called my parents and told them that I got my medical records and that I know everything. I know that I'm not really a female. I know about every single surgical procedure that was performed on me, and it was silence on the other end of the phone. I could just feel their hearts sink. They immediately started to apologize, and they said they wanted to tell me, but they were told not to. And then they said they got to a point in which they just couldn't tell me, because it's like, how do you tell somebody that after all these years and after all that they've seen me go through? I told them I forgive you, and I did. I forgave both of them like it never happened. If I were in their position in 1977 being pressured by medical experts, I'm not sure how I would have handled it. I love my parents, and I'm proud to be their son, and now I can truly honor them with clarity. I began the process of reclaiming my birth gender, which ended up costing me tens of thousands of dollars and more in surgery because my insurance wasn't covering it, but I didn't care. It was my mission to reclaim my birth gender and move on with my life. I spent 34 years, 9 months, and 15 days living the way that man had created me. Now it's time to live as God has created me. Thank you.
Thank you, Jay. Thank you for your heart and your willingness to come forward. Representative Regas.
Thank you, Mr. Chair. Thank you, Jay. And just a quick clarification. You were born in 1977.
Yes, ma'am.
You're not old. Okay.
I'm getting
Because
there.
if you're old, I'm older than that. So I just wanted to get that out of the way. So what was the age when surgeries first began?
I believe the medical document said within the first 3 months
Of your life.
of my life. Yeah.
What surgeries did you have?
I wish I would have brought my medical documents. I can send that to you if you'd like.
I had no idea.
but
Was that
It was to remove the gonads. I had one testicle. The other one was not developed, and it kind of just looked sort of like a mass of tissue. So I think they biopsied it, and it wasn't cancerous. So it was, I guess it's like a castration.
Did you have surgeries when you were older, or they were
Yeah.
mostly when you were an infant?
Yeah, there was. It said that I had kidney issues as well, which is ironic according to the other testimony. But there were, plastic surgeries performed on me. There were hernia surgeries performed on me. There were complications that caused infections, and I could send you all that information if you need it.
Thank you.
Yeah, of course.
I guess what were your fair and appreciate again your willingness to try to look at things through everybody standing in the room at the time when you were born. But what were they facing? I guess I don't quite understand sort of why the decision was on the table. What made you different from other babies born?
Well, just the hormonal imbalance, which affected my reproductive organs. So, gonadal dysgenesis is a underdevelopment of your gonads. So, their positive intended result was to fix what was going on. I do believe that they did have a positive intended result. But I just feel like they were kind of shooting in the dark. I think the proper procedure would have been to just allow me to develop as a baby boy, and as I got older, and required surgeries to perform them in that sort of a timeline. But my parents felt like they were being pushed into making very, very quick decisions, and it's again, ironic with the other testimonies. My parents were also told that, suicide rate was high if I didn't blend in and if I didn't have a normal male life. So they were just like, my mom was like a plastics factory worker. My dad was a dog handler at that time. So they had no sort of education about any of this stuff. They'd never even heard of it. And so, to them, it was just, okay, whatever you think is the right move, let's run with it.
Thank you. Representative McDonald.
Thank you. I just want to say thank you so much for your testimony. It's very brave, and I did read more about your story online and listen to some interviews you've done, and it is remarkable how forgiving you feel about this. And although, yes, I agree, too, that you are not old, by even more, are you aware at all whether this kind of thing is happening now in terms of, because this sounds more to me like something that used to happen before, say, the 90s and in 2000s, where decisions like this were made virtually at birth. Like, I'm thinking about intersex issues and things, and I know there are hundreds of thousands of people around the world who were born in the 50s and before who had these decisions made about them, and just somebody just decided to get out a scalpel and make that decision for a child. I don't know if they understood what they were doing or not. It sounds like clearly even in 1977 they had no idea what they were doing. But I just appreciate that, and I do feel too, I wish your parents had listened to you, because not that I would blame them, you clearly don't, but that how you felt that you're not in the right body and being raised in the right body. So thank you so much.
Representative Piquette.
Thank you, Mr. Chair. Thank you, Jay, for being here in person. Obviously, you live in my district, and I'm grateful that you made the drive. Your, spirit of forgiveness is something that, it's inspirational, to me. I know you forgave and talked to your pediatrician, the doctors, but they still are carrying on some of this work. If you could highlight some of that, and then also what message you might have for children who are born healthy who might be choosing this path that you were put on that you did not choose.
Thank you for the question. I did have a chance to meet with my pediatrician. I reached out to her. I don't know how I got her email, but I think I just looked it up on the website. But, graciously she responded to me, and, I got to go down to meet with her and, just talk and, just person to person. And, yeah, she admitted that, they made a really bad call, and that she thought about me, just always thought, like, how did I end up? And that she actually apologized to me, and that, I immediately was like, it's I forgive you. I forgive even, the entire team. I didn't meet with everybody, but I forgive them. It is what it is. And I just said that, like, I asked her, are they still doing these types of surgeries? And she said no, and that they are waiting for further development of the child to just sort of see, how the child develops, and just, like, I think doing the surgeries according to that sort of as needed medical procedures, for medical value. And so, that was good enough for me. I was grateful to meet with her, but then, later on, when gender-affirming care became more of like a buzzword, I actually didn't really know what it was at first, but then it sort of became like a buzzword, so I got, like, curious and started looking into it, and come to find out that same hospital is still doing these surgeries. And I reached out to her, and just to say, look, like, I'm just a person, I have an experience, but I do have experience to offer, at least to talk to patients or parents or families or med school or anything like that, in a professional setting. I have no beef with anyone. But at least just to offer challenge, pushback to some of these, heavy decisions that are being made, just to have a logical conversation, share my experience with it, because that's really all that I knew. So, and what I know is you can't change somebody's gender through surgery. It just doesn't work. And so, and I wrote that in an email and sent it out to her. And I actually, while we were meeting, I said, I'd be interested in, talking to families or doctors or anybody that's making these policies, just as some scrutiny, some pushback, some challenge. It's fair. And she was all about it. She said, we could certainly set that up. It never happened. But then when I reached out again and just said the same thing, she never responded back, and I haven't heard from her since. So it sort of put a bad taste in my mouth. I get it. She has a job. I just don't, morally, I just don't support that. I think that it's very dangerous. And again, I think that doctors are sort of just shooting in the dark when they perform these surgeries. So it's certainly brought a level of, distaste to me.
Thank you. Appreciate this very much. Thank you, Jay. Next, we'll hear from Jamie Reed. Jamie is a former case manager at Washington University's Transgender Center at the St. Louis Children's Hospital and will testify to her on-the-job experiences in that facility. Thank you for being here, Jamie, and start when you're ready.
Good morning. My name is Jamie Reed, and I hold a Master's of Science in Clinical Research Management from Washington University in St. Louis, Missouri. I am a lifelong Democrat, and one of my heroes has always been Michael Moore, a filmmaker from here in Flint, Michigan. I'm the mother of 5 boys, 3 of whom were adopted from foster care, and I am a lesbian. I am also the public whistleblower from the Pediatric Transgender Center at St. Louis Children's Hospital, where I worked for nearly 5 years, and I helped facilitate the medical and social transition of nearly 1,500 young people from the age of 3 until the age of 26. I came into this field from the field of HIV because I believed in compassion, science, and evidence-based medicine. I truly believed that I was helping children. But what I discovered and said was a system that has been built on deception, financial incentives, and the abandonment of basic medical ethics. To understand how we got here, we have to understand where this began. In the Netherlands in the 1990s, a clinic in Amsterdam developed what has become known as the Dutch Protocol. It was an experiment on 70 children, designed as a 3-step process. Give a puberty blocker at Tanner stage 2, cross-sex hormones around the age of 16, and surgery on or after age 18. This experiment began because adults who had transitioned were not doing well. It was built on an assumption that a child could declare that they are trans and then could and should be validated through a medical intervention. Of those 70 children, 68 were same-sex attracted. They were homosexuals. Boys who would have likely grown up to be gay men, and girls who would have grown up to be lesbians like me. The very first patient, known as FG, was a young lesbian with a homophobic father. One participant, a young man, died after surgery because the puberty blocker had prevented normal genital development. The surgeons could not use his penis to create a neovagina, so they cut out a portion of his colon. This young person developed a massive infection and died. Despite a study having 70 participants, 68 of whom were homosexuals, and 1 dying, it was declared a success. But that success depended on a statistical illusion. The researchers created their own measurement tool. They gave the boys scale before they were treated, and afterwards they gave them the girls scale. They claimed this was the gender dysphoria improvement. This was not science, this was circular reasoning, and it became the foundation for a worldwide medical protocol. The puberty blockers that they use, such as Lupron, have never been approved by the FDA for gender dysphoria. These are gonadotropin-releasing hormone agonists designed for conditions like prostate cancer or real precocious puberty. Always short-term use in adults and children under direct supervision. Their long-term effects on cognition and bone development were never tested before this protocol was given to young homosexuals, because homosexuals have always been okay to be harmed. In fact, later studies in animals found that GnRH had permanent changes to memory, proof that this class of drugs alters brain development when given during puberty. Yet we have been prescribing them here to children, calling these safe and reversible. In 2007, Boston Children's Hospital launched the first U.S. pediatric gender clinic modeled directly off of Amsterdam's protocol. Soon, gender clinics opened in children's hospitals across this country, but these were not children with failing endocrine systems. These were often healthy, autistic, anxious, traumatized, and same-sex attracted adolescents. We were told that we were born in the wrong body. When I began working at the St. Louis Children's Hospital Gender Center, I was still an absolute true believer. But over time, I saw how profoundly unethical this system had become. Patients were coming in with autism, depression, borderline personality disorders, eating disorders like Prisha, ADHD, trauma, self-harm. Instead of stabilizing these issues first, we labeled everything gender dysphoria and proceeded to medicalize them. Our informed consent process was deceptive and not diagnosis. The biopsychosocial assessment that supposedly screened patients was inconsistent. And for a process to truly be diagnostic, there must be a statistically significant number of people who are told no. That never happened. Parents were told that these thorough assessments were performed and that only the well-screened true trans candidates were treatable. This was false. Clinicians openly stated it doesn't matter if a patient even met diagnostic criteria. If a child said they were trans, they were trans. Parents who hesitated were dismissed as unsupportive. We pushed them out of the room, like Johnny's mom, and we told parents in front of their children that their children would die and commit suicide in front of children if they would not agree to immediate medicalization. We also built an entire network of affirming therapists who agreed to comply with our expectations. I personally distributed a fill-in-the-blank pre-drafted letter for hundreds of patients. Letters that all the therapists had to do was write in the patient name and then would automatically qualify them for hormones or surgery. I heard the nurse say out loud, "We are committing insurance fraud." And I stayed silent. Eventually, I couldn't ignore what I was seeing. One of our 19-year-old patients called within 3 months begging to have her breasts put back on. When I told my supervising physician, "We are harming patients," he replied, "I know, but what do you want me to do about it?" When I hear that people are still citing a 1% expressed regret rate, please know what you are absolutely not being told. We lost 30% of our patients who we initially medicalized. They never came back, yet I knew they had not moved or left my medical system. Most of the individuals who medicalize will take 7 to 10 years to realize what harms were done to them. Today I listened to a young man who was harmed by the exact same system and protocol I once believed in. He received care here in Michigan, not from me directly, but from a clinic that operated under the exact same model where I once worked. Hearing his story filled me with deep sorrow and shame. I am devastated by the knowledge that I took part in an industry that harms young people, most of whom, if left alone, would have simply grown up to be healthy gay men and lesbians. I am devastated that my party, the Democratic Party, is still supporting gay conversion. I believed I was practicing compassion. I believed I was helping. Before I close, I want to say something directly to those who lived through this harm. To Johnny and Prisha, and to every young person who I led down this path. I am so deeply sorry. You should have been protected. You should have been given time, compassion, and honest care. And instead, adults, myself included, failed to see you clearly. We called your distress an identity, and we medicalized your pain. All the while, we told you that you were part of a new civil rights movement. It was abandonment, distressed, dressed up as compassion, and you deserved better from all of us, especially people like me who should have known better. I cannot undo these harms, but I can dedicate the rest of my life to telling the truth and to protecting others, and to try to stand beside you and walk with you as you try to rebuild your life. Around the world, countries that once led this movement are reversing course. In the UK, the Cass Review found that the evidence for pediatric gender transition was built completely on shaky foundations, and the Tavistock Clinic was shut down. Sweden and Finland, countries that as a liberal Democrat I once looked to as the pinnacle of what we wanted for our society, have now restricted puberty blockers. Even the global advocacy groups behind these interventions are starting to quietly admit that the evidence of benefit simply does not exist. Michigan has always stood for protecting children, not exploiting them. Yet in the name of progress, our institutions have repeated the mistakes others are now reckoning with. I am not here as a partisan. I am a lifelong Democrat who believes medicine should be grounded in evidence, ethics, and the duty to do no harm. And I am also a lesbian who believes that gender nonconformity should be embraced as a natural beauty, not pathologized. And I am also a whistleblower who believes that children should never have been sterilized for an adult ideology. Countries, liberal, democratic European countries, are reversing course. The same will happen here. The only question is, how many children will continue to be harmed before we act? And how many of you will realize 20 years from now that you supported gay conversion and the castration of young gay men in the name of civil rights? Michigan can choose to lead, to defend children's bodies, their minds, and their futures. Please help ensure what happened in my clinic, which has now been shut down, will stop happening here in Michigan, and this is ended as quickly as you possibly can do so. Thank you for your time and your service to the people of Michigan.
Thank you, Jamie. Could you go into some detail about the support that is given to those that want to transition and those that want to detransition? Can you talk about the difference there?
In our country currently, if you seek a medical transition as a minor or as an adult, I can immediately give you programs that will pay for every step of the way, that will physically pay to move you across state lines from states like mine, where bans are currently in place, to states like yours. If you seek a medical transition for your child, you will be not only supported fiscally with everything you have, but it will be declared by many people that this is a cheerleading effort for new civil rights. If you are a detransitioner, however, you will have zero pathway to seek medical care because there is not even an insurance code with which for your care to be billed. Most of the detransitioners that I work with are gays and lesbians who have had their body parts removed, the parts of their bodies that we as gays and lesbians experience our pleasure from. They have been cut off their bodies, and they will never be able to put those body parts back on. My former spouse is a detransitioner herself. Her hairline starts all the way back here because of the 13 years of testosterone use. There is no way, no one, no how who will assist her in paying for her hair reconstruction. She has had no one to assist her in paying for the laser removal to remove her facial hair. I don't believe any detransitioner has had any support to do that. They are simply not recognized because to even recognize their existence is to understand that the ideology itself it's a crumbling, illogical fallacy.
Representative Paquette.
Thank you, Mr. Chair. Thank you, Jamie. You mentioned the playbook, and you being from Missouri and working there, I've been digging in here in Michigan, and I've realized it's the exact same playbook that's being used. And meeting children, who are now adults and trying to get information has been very difficult. Yet, speaking with one gender doctor out of U of M, Jesse Krikorian, I realized very quickly that children are being told they need to freeze their egg or sperm because what they're going through, at 12 years old, will render them sterile with the medicalized path that they get put down. And people don't realize what is happening, specifically with young gay and lesbian children. And with this, and I guess getting it made known, where have you seen difficulties? You mentioned and alluded to it a little bit, where children aren't able to get care, people aren't able to get care after they're put down this path. There's no code for it. Why aren't, and you're all around the nation talking about this, why aren't people picking up this story and letting it be made known?
Humans don't like to admit that they're wrong, or that they've made a catastrophic mistake, or that they were themselves tricked into believing something. We don't want to admit that. It's incredibly shameful to do. But I can tell you part of my job was to work with children on what you're referring to as fertility preservation. Fertility preservation only works if somebody actually begins the process of puberty for a boy. The sterilization of this protocol is primarily borne onto the young boys who, if this protocol is done correctly and they're given a puberty blocker at Tanner stage 2, their penis will never develop, their testicles will never develop, the pathways in which spermogenesis, the way that the testicles would even produce sperm, doesn't develop. The only protocol that we have right now for that kind of fertility preservation is actually to remove a portion of the testicle, freeze it, and then at a later date implant it in the abdomen area to see if it will actually become revitalized enough to start the pathway to produce sperm. This is absolutely a sterilization and then later a castration protocol, especially on these young men.
And just another point I need to make is that, if Michigan media picks up this hearing, what I've come to find over the last couple of years, anytime that we've spoken out against this or talked about the actual science around this, they always cite, well, the American Medical Association supports this, the American Academy of Pediatrics supports this, and we've delved into that and reached out to the president. He spoke with us and connected us to one of the experts who is not an expert at all in any long-term setting, and that just needs to be known. And I hope that people will pick up your story today and what you're talking about and realize that this playbook is being employed here in Michigan, and we've been leading the way in many very, very nefarious ways, and it's diabolical and it's wrong, and it needs to end sooner rather than later. So thank you so much, Jamie.
Thank you.
So the medical community and sort of society in general is supporting kids transitioning. Gets back to my other question. What are they left with when they want to go back? And what treatment can't they get when they want to try to go back?
For a moment, though, I think I want to pivot and recognize that it's not just those who recognize that the harm has been done to them. It's not just those who say, I identify as a detransitioner. Even those who claim that this is something that is caused them happiness or that they do not regret, there is an 80% rate of serious surgical complications. There is the creation of a lifelong endocrine disorder that in many cases will shorten the lifespan and decrease the medical health of those who are undergoing it. I care very much for those who know that they've been harmed by this, but I also care very much for those who have been sold this concept that their body is wrong and that it somehow needs to change, because most of the people that do transition, that were sold this concept, are homosexuals. And most of us do experience intense shame and pain as young people, feeling like we were born in the wrong body. Some of my earliest memories are not understanding why I wasn't born a boy. It takes a long time for gay people to come to realization of our alignment with our body and our sexual orientation. Even those that claim that this was perfectly causing them happiness are still left with myriads of medical problems. They're harmed. This is simply violence on the body.
Is there a financial incentive for the medical community to continue down this path?
Absolutely. So I worked in a pediatric endocrine division. In a pediatric endocrine division, you can ask any of your major hospitals, are they normally in the red or are they normally in the black? Do they normally lose money or do they bring money in? The endocrine division in pediatrics is a money-losing division for the hospital because the primary group of who is being treated there are type 1 diabetic kids. Most of those kids are on Medicaid, and most of those kids have significant medical needs. They need to be seen often. They need a lot of support care. As soon as the Pediatric Gender Center opened in my hospital, within 2 years, the endocrine division suddenly was saying, we don't know what happened, but we're now in the black. We're actually making money now because the Gender Center initially thought that we were going to have 50 patients total, and we ended up having close to 1,500 because there was also a social contagion that occurred at the same time. They're absolutely making money. The price of Lupron, a single implant in the arm for these kids, is about $60,000. Plus, then you get to book it in same-day surgery. You get to charge same-day surgical procedures, the endocrinologist, and oftentimes those implants are being swapped out multiple times across the lifetime. This is absolutely making money for the hospital. But the other question is how much money would the hospital lose when they openly recognize that they have been participating in one of the greatest medical scandals that has ever been seen in pediatrics in our country? They're going to go bankrupt if they openly acknowledge this. The American Academy of Pediatrics would go bankrupt if they openly acknowledged this. They're also being sued currently. They know they can't publicly say anything.
Thank you. Thank you for your testimony. I'm grateful for today's testimony and everyone's willingness to come before this body. It is the intent of this committee to provide oversight of the care administered to minor children who are not yet equipped to make medical decisions that will follow them for the rest of their lives. Life-altering care should not be offered to children. I have strong concerns that gender-affirming care was offered in a pediatric setting. The major hospital systems in Michigan that offered this have now stopped. But as we learned today, we need to better understand the lifelong ramifications this care can have on our children. We must also learn how therapies and procedures were coded and billed through insurance. If efforts were taken to conceal care, there must be accountability. This is an issue in need of oversight that we will continue to investigate in the coming months. We have a duty to protect children who are not ready to make lifelong health decisions. There being no further business before the committee will stand adjourned.